Patient education. Groin hernias. What is a groin hernia? Groin hernias, also known as inguinal hernias, occur when bodily tissue, for example intestines, protrudes through a weakness in the muscles of the groin area. Inguinal hernias are usually caused by a defect or opening in the muscle wall that should have closed before birth but instead remained open. Because of that opening, a weak spot develops in the lower abdomen near the groin area. When tissue pushes through that defect or weak spot, it creates a bulge that can be painful, especially after strenuous activity such as lifting something heavy or athletics. The primary symptom of an inguinal hernia is a lump or bulge in the area of the groin that causes pain and discomfort, especially with activity. That bulge may occur suddenly after coughing, laughing, lifting large weights, or otherwise exerting, or it may develop gradually over weeks or even months. One may experience pain or general discomfort in the area of the groin, and this can get worse and more painful with any of the previous situations. Inguinal hernias can cause significant discomfort, such as pain, aching or burning in the area of the bulge. Some male patients may experience swelling and pain around the testicles if the protruding tissue, usually the intestines, descends into the scrotum. What is the cause of inguinal hernias? In most cases, an opening in the muscle wall that should have closed before birth but instead remained open, is one of the main causes. A hernia is actually the opening in the muscle wall that allows tissue to protrude. In adults, other causes that can contribute include chronic coughing, chronic sneezing, pregnancy, straining during bowel movements, strenuous activity, lifting items, or sports. In men, that abdominal weak spot or defect usually develops into a muscular canal called the inguinal canal, through which important testicular structures enter the scrotum. Women, on the other hand, have a structure in their inguinal canals which is a ligament that helps to stabilize the position of the uterus. How are inguinal hernias diagnosed? Most commonly, patients self-diagnose with a bulge and/or pain in the groin area, then come to see a doctor. The patient's primary doctor can diagnose the inguinal hernia with a patient history and physical examination, and then refer to a surgeon. Special X-rays called CT scans and MRIs can also diagnose a hernia with great accuracy. Is it more common in men or women? As a whole, inguinal hernias are more common in men. However, a subset of inguinal hernias called femoral hernias are more common in women. Femoral hernias tend to occur lower in the abdomen than inguinal hernias. The lifetime prevalence of inguinal hernias is estimated to be 1/4 to 1/2 of all males and under 10% for females. How are inguinal hernias treated? Usually, surgery is needed for inguinal hernias, as they do not close on their own. However, this is on a case-by-case basis. Is surgery always necessary? For adults with small hernias that are not causing symptoms, the doctor may recommend a wait-and-watch approach. But most people with inguinal hernias, but without symptoms, will eventually develop symptoms and need hernia surgery. There are also certain complications of inguinal hernia for which surgery is almost always necessary. Incarcerated hernia. This is when a hernia grows to block the intestine, as the intestines become trapped in the weak area of the abdominal wall. Blocked intestines will result in nausea, vomiting, an inability to pass gas or have a bowel movement, and severe pain. This is called a bowel obstruction. Strangulation. An incarcerated hernia may block the flow of blood to part of your intestine, resulting in strangulation. That strangulation can result in the death of the affected bowel tissue. A strangulated hernia requires immediate surgery because it is life-threatening. How is inguinal hernia surgery performed in general? Hernia surgery can be performed mainly in 2 ways: through open surgery or minimally invasive surgery. In open surgery, The surgeon makes a groin incision to inspect and fix the hernia. Usually, the surgeon will place mesh over the hernia weakness and secure the mesh in place with stitches. The mesh is intended to reinforce the weak portion of the abdominal wall where the hernia developed. In minimally invasive surgery, the surgeon makes multiple tiny incisions in the lower abdomen and inserts special thin long instruments. A piece of mesh is often used by the surgeon to seal and reinforce the abdominal wall hernia defect. Some doctors choose robotic surgical repair, which involves sitting at a console guiding robotic arms that execute the procedure in a minimally invasive fashion. How well does inguinal hernia surgery work? Success rates for inguinal surgery are as high as 90%. About 10% of patients experience a recurrence, or return, of the inguinal hernia, sometimes requiring another operation. It is important that you see your primary doctor or a surgeon if you are feeling pain, discomfort and/or have a protrusion in your groin area. They can assess you and advise you on the best course of action for you, including surgery.